We are going straight to the experts in Boston for insight into the coronavirus pandemic. And tonight, we're joined by Dr. Robin Colgrove, an infectious disease physician at Mount Auburn Hospital. Thank you for being with us. Governor Baker said today that, quote, "We have in fact flattened the curve." Those are his words. The first wave of reopening, that could start in about a week. Once we're there, what indicators would you expect health officials to watch for so that we know the virus is under control?
Yeah, so it's important to know that flattening the curve, although a good thing, comes at a price. And the price of flattening the curve is spreading the curve out. So we're in this for the long haul here. And what we'd be watching for are a few things. One of them, obviously, we want to see case numbers going down, which we're starting to see now. And that may be an uneven process. Another one important at the system level is to make sure that hospital capacity is increasing. We never really ran out of beds or ICU beds or ventilators, but things were tight for a while. But we'll be watching to see those numbers come down. And then finally, testing capacity will be critical to make sure we can test more people.
Okay, good benchmarks. All right, so social distancing, also wearing face coverings. Remind us how important those things are, and how long do you think those practices should stay in full effect?
Yeah, so the new normal is not going to be back to the old normal anytime soon. I think it's important to emphasize that the transmission of this virus is short range. So this is not a virus that floats long range in the air. This is something like influenza that is really short range. And so distancing in all its forms is critical. That means staying home from when you're sick, avoiding large crowds of people, and wearing a mask when you're sick. All of those things are going to be with us for a while.
Just get used to it. Yeah, it does feel like every day we're still learning a lot about the virus. We know that it impacts kids differently than others. Are we learning anything more about the different ways that it presents in adults?
It presents differently in adults and children, and different with age and different with different medical problems. I think one way to think of this is now that we're seeing so many cases, we're starting to see the unusual manifestations of it, and we're starting to see those now. So I don't want to lose sight of the main thing, that this primarily is a problem with advancing age. But now with children, we're seeing other presentations of it, small numbers, but still significant numbers, who have inflammatory conditions rather than really respiratory conditions.
All right, things to watch. So one last question I want to ask you about remdesivir. We talked about it here. That drug seems to reduce COVID-19 symptoms in severe cases. It's now being distributed to hospitals. It's in short supply, though. How difficult will it be for hospitals to decide which patients receive it? Is it still only in that clinical trial setting?
No, it's available now in an emergency use agreement and limited numbers, as you say, in hospitals across the state. But this is important to remember what this drug does and what it doesn't do. So this is a drug that directly decreases viral replication. So it is most useful at the time when the virus is actively growing. That is to say, early in the infection, when there's a race between viral growth and the host immune system. That'd be the time it would be most useful. It's not something likely to happen late when the virus has already done its damage and gone. So I think that's how we're thinking about using it now. But it's still early days, and we have a lot to learn about this drug.
Yeah, important distinctions. All right, Dr. Colgrove, thank you so much for your time. We really appreciate it.
My pleasure.